It's a new day at Chelsea Community Hospital. Change is in the air. New opportunities wait just around the corner. Now, as we prepare to embark on the next exciting chapter of our story, the time seems right to pause, look back at where we've been, look around at where we are, and look ahead to imagine what we'll achieve next. This is a moment for reflection, a moment to capture our spirit. Dr. James Botsford and Dr. Michael Papo saw potential in the up-and-coming community of Chelsea. They also saw something special in its people, a spirit of community that they wanted to be a part of. Chelsea flourished in the early 1960s. Thriving companies like Chelsea Milling, Dana Corporation, and Federal Screw Works brought jobs and new residents to Chelsea, and with them, the need for more and better medical services. Doctors Botsford and Papo's practice was prospering too. Guided by a spirit to succeed, they joined with other area physicians and community leaders and began to talk about the community's healthcare needs and what should come next for Chelsea. This visionary team quickly agreed that the community needed an acute care hospital, but the state of Michigan saw things differently. Responding to a statewide need for more long-term skilled nursing care, they approved instead the construction of a skilled nursing facility in Chelsea. A site was identified and ground was broken in the late 1960s for the facility.
Dr. Papo and I were interns at St. Joseph Mercy Hospital in Ann Arbor, and we were seriously thinking of moving to Dexter when we finished our training. However, we were invited out by some of the town fathers for a free meal at the old Shum's restaurant, which no longer exists. And so we couldn't turn that down, of course, because hospital food, as you know, except for this hospital, leaves something to be desired. So we liked what we saw in Chelsea, and we came here in 1958. Our initial offices were downtown Chelsea. And there were only two other doctors in town at that time, and two semi-retired doctors, so they were actually quite short of doctors in the area. We started out downtown Chelsea, near the Heidloff building there. We quickly built up to 5 doctors, and within 5 years, by 1963, we outgrew our facility downtown Chelsea. And so it was either close the practice or build a new building. We found the property here in the Peat Marsh, and in 1963 initially built the clinic building and the 2 smaller adjacent buildings to it. The people in town felt that we were going to sink into the swamp. They thought we were absolutely crazy.
The location was pristine. Set in a densely wooded parcel at the south end of town, it was peaceful and picturesque. The facilities were state-of-the-art. Unfortunately, it still wasn't the full-spectrum hospital Doctors Papo and Botsford envisioned for Chelsea.
Actually, the hospital really began then in 1967, a few years after we moved out here. And the original building, hospital building, was built as an extended care facility, not as a hospital. And it was built by Medicines of America, which was a subsidiary of Holiday Inn. And that's why some people get the impression that it does look like a Holiday Inn hotel.
The doors of the 54-bed Chelsea Hospital opened for the first time on September 17, 1970. Within the year, with nearly twice the number of beds in service, we occupied the entire 40,000 square foot H-shaped facility. We were on our way. The decade of the 1970s saw a tremendous change at Chelsea Community Hospital as we expanded beyond the fundamentals, growing along with our community to offer the wider spectrum of care Chelsea needed. In 1974, we established the Chelsea Surgical Center, the very first outpatient ambulatory surgery facility in Michigan, and one of the first in the nation. Then, as now, our focus was on improving patient care. In 1975, Will Johnson was hired as the hospital's first full-time CEO. Under Will's leadership, the hospital would continue to innovate and lead in specialized medicine throughout the 1970s, with the opening of the Burn Rehabilitation Unit, a nationally recognized head pain treatment program, psychiatric and substance abuse treatment programs, and physical medicine and rehabilitation. Will believed strongly that the hospital needed to be an integral part of the community, and he encouraged local residents and service clubs to use the hospital for meetings and community events.
I had interviewed Will on the telephone, and we had 2 or 3 conversations with him. I interviewed his CEO, who was a sister, it was a Catholic hospital. And she said, well, he's a bright young man, but you have to hold the reins on him. And I said that, and I said, you know, that's just the kind of person that we need here.
That was a very, very wise choice. He was particularly suited, his skills and intuition were particularly suited to the needs of Chelsea Community Hospital.
I came to the Chelsea Hospital campus for the first time in the spring of 1976. I looked around and I thought to myself, this would be a great place to practice medicine. Now, every day when I come to this hospital, nearly 100 other doctors come here also who had the same thought when they came to this campus. One of the things that I was told when I came here that wasn't the reason why I came, but it was influential and true. Somebody said, you know what's unusual about Chelsea? There's no Monday morning blues.
During this period, we also established one of the hallmarks CCH would come to be known for, being first. That's why in 1977, CCH celebrated another first, opening Michigan's first employer-sponsored child care center.
When I first started, the physicians actually dictated on belts, and then they moved to tapes, and now it's all digital. So big difference for them, and then in the future it will be voice recognition.
One thing, Will was very successful in recruiting money. So we would have money to do something that maybe we hadn't planned on doing. And he came up with so many projects, we accused him of having a groundbreaking shovel in the trunk of his car.
You know, Chelsea's always been a happening place. When I came here in the 70s, we had just opened the first ambulatory surgery center, the first outpatient surgery center in Michigan. We were just developing a burn program in collaboration with Dr. Irving Feller from the university. And in a small community hospital, we were going to be providing the rehabilitation care for burn patients after they finished their critical care experience at the university. And then all of their reconstructive surgery was done here as well. You know, we were the first hospital in Michigan, I think in the nation, to develop a residential facility for substance abuse care. So we always had sort of new ideas, people with a passion for what they wanted to do, and they were able to come here and in working with the rest of the clinical staff, with the administration, to really develop something special at Chelsea Hospital.
If the 70s were about expansion, the 1980s were about specialization, as Chelsea Community Hospital took a closer look at the special needs of different populations within the community and responded with a spirit of compassion. In 1981, Kresge House was built. Designed to offer residential substance abuse treatment, Kresge House was one of the first such centers in the state. Later in the decade, Chelsea would establish a women's health center, a traumatic brain injury program, and a sleep disorders program, along with expanded services for inpatient rehabilitation.
When I came to Chelsea Hospital in 1981, it was the beginning of a period of growth for the hospital and the development of a number of new programs and services. And throughout the 80s, we saw a number of new facilities built, including the therapy wing and new dining room and expansion of the surgery department. And through then the latter half of the 80s and 90s, we continued to see facility expansion.
The physical boundaries of CCH evolved as well during the 80s to make room for these and other new offerings. A new two-story therapy wing opened in 1980, housing therapies, cardiopulmonary services, a pharmacy, and more. That same year, the University of Michigan established the Family Medicine Residency Program, along with the Family Practice Center.
Strength in Chelsea Hospital through the years has been the partnership and collaborations that we have enjoyed with both St. Joseph Mercy Health System and the University of Michigan Health System. There have been many ways in which we have collaborated. We have the University of Michigan Family Practice Residency Program and Family Practice Center here. And we also share many members of the medical staff with the St. Joseph Mercy Health System. And we have been very fortunate over the years to enjoy those strong relationships, and we look forward to them continuing.
And once again, CCH proved to be ahead of our time when, in 1987, our earth-sheltered office building opened to house administration, finance, human resources, and volunteer and support services. This early example of green building practices reflected our spirit of environmental stewardship. We've never taken our surroundings for granted. Clearly, we've known from the start that we have something very special here. In this place, we've proven that a great community hospital lives up to its name, delivering excellence in medicine within a caring community.
Well, I've been at Chelsea for going on 33 years, came here as a staff nurse, and had progressive opportunities to be in leadership roles. Because I'm director of nursing, I'm very proud of the patient care delivery, the relationships that we have between the medical staff and the clinical providers of care, whether it's therapy staff, social workers, nurses, nursing assistants, exceptional care. People come here because they want to be here, they want to work here. They're committed to the patient. They want to do an outstanding job of taking care of patients.
In classic CCH style, we countered the me decade of the 1990s with our own we decade, reaching further, even beyond the borders of our Chelsea campus, to bring our spirit of excellence and caring to more people in more places than ever before. Chelsea Orthopedic Specialists debuted in 1991. and over the next decade it would grow to become a comprehensive orthopedic center. In 1992, another major on-campus expansion made it possible for us to bring diagnostic imaging, laboratory services, and surgery under one roof, streamlining diagnosis and care for more patients. Later in the decade, the new University of Michigan Chelsea Health Center building opened on campus, and an expansion of our emergency room was completed in 1999 to deliver state-of-the-art emergency care to Chelsea and the surrounding area.
My coworkers are really good to work with. I think we all work really well together. If there's a problem, we come together and we solve it. And when we get like super busy in the ER, people just tend to step up. Even other floor, like if we call the ICU and say, hey, we're overwhelmed here, can you take a patient off our hands? And they'll take so there's not anything really specific, but there is those occasions that when it's overwhelming down there and we get critical patients, and that ties up one nurse, that we can call on other people and people will step up and help out.
Years and years ago, they asked the community, what is the most important clinical service here at the hospital? And by a large margin, they mentioned the emergency room. The community mostly feels they have a need for emergency access. And I think the hospital got that message also, clearly. The board has that message, and they've given us the resources to be successful.
In 1996, we established Chelsea Care Home Health to deliver a wide range of nursing, therapy, and other services to where our patients live. The following year, Family Medicine of Stockbridge opened, bringing comprehensive medical care to the residents of that nearby community. That same year marked another milestone and another example of the spirit of collaboration that guides our approach to practicing medicine. Partnering with United Methodist Retirement Communities, we began construction of Silver Maples of Chelsea, a retirement community that combines independent and assisted living options for seniors. The decade of the 1990s ended with Kathleen Griffiths taking the helm at CCH as President and Chief Executive Officer.
It has been my privilege to be the President and CEO of Chelsea Community Hospital for nearly 11 years now. And it has also been a wonderful opportunity to build on the legacy of our founders and our first full-time CEO, Will Johnson. In my 28 years here at Chelsea, I've seen tremendous changes, not only in new facilities that we have built, but also new programs and new services and things that we've been able to bring to serve this community better.
Recognizing the importance of wellness and prevention, Kathleen oversaw the development of our Health and Wellness Center, which was completed in 2001. Combining health and fitness facilities in a medical-based setting, the center focuses on improving the physical and emotional health of our community. Our recent milestones include a major expansion and renovation of our surgery center, a state-of-the-art medical data center, and in 2006, the completion of the tallest structure on our Chelsea campus, our professional building, which houses a variety of physician practices, outpatient diagnostic and treatment services, and just this year added one of Michigan's most powerful MRI systems. We continue to reach out to surrounding communities as well, with the opening of Dexter Internal Medicine and Pediatrics. Certainly, 4 decades of accomplishment gives us much to celebrate, but there's so much more to our spirit than our history. A real-time measurement is needed to truly capture our spirit. For that, one need only look at the men and women of Chelsea Community Hospital. Our greatest resource, and indeed our greatest cause for celebration, is our people.
The people that were working with us when we started have the same values. as the people that we have working with us now. That's something that's never changed in this organization. We hold integrity and honesty very high, and those are the kinds of people we look for here. So I think that that's only increased, that the caliber of people that we hire and the caliber of people who are attracted to us are really committed people.
Today, over 1,000 employees make up the Chelsea Community Hospital family. That family includes nearly 300 physicians representing almost every medical and surgical specialty. Ours are among the finest physicians in the region. They choose to have all or part of their practice in Chelsea. They know they're part of something truly special. Ask any member of our dedicated team to describe what sets us apart.
And I mean, I've worked with some of the people here my whole time, 27 and a half years. And so they're like family.
I like what I do. I really just, I enjoy my patients. I enjoy the staff that I work with. We are very much a family. I think if I didn't enjoy the people I work with, it'd be really hard to come in every day, and it's not. It's really very enjoyable.
People working together to get done what needs to get done.
People really want to stay and be part of this hospital. And I think over time, they really do feel as though they have become part of the Chelsea family. We all feel that way, I think. And it helps bind us together in a common cause of providing the best care we can for our patients.
Some might say that our reputation sets us apart. Various independent organizations have consistently ranked CCH among the top 10% of hospitals in the nation, in areas ranging from critical and emergency care to patient outcomes and quality. We've received some of our highest scores to date this year, thanks to the hard work and dedication of every member of our team. But despite our countless national accolades, we work hard to cultivate a spirit of continuous improvement. After all, we're only as good as the work we do today.
As we think about the support that we've gotten from the community, one of the things that really touched me several years ago was a letter I received from a young boy and his two sisters. And he was about 6 years old, and he sent a little card with a note in it saying, "Please use this money to help the sick people." And then he and his sisters signed it the Helper Club. And since then, we've gone on actually to use that phrase, the Helper Club, and in collaboration with the local teddy bear factory and their generosity, we now have teddy bears available to children who come into our emergency room with a little t-shirt on it that says Helper Club. I think that letter touched me more. It said more about how people think about this hospital, how important we are to the community, how they think about this as a place to come. And here we had a young child saying, "Please use this money to help the sick people."
Tranquility, privacy, rest. Words rarely used to describe most hospital settings come to mind easily as soon as you drive onto our campus or visit any of our facilities. We know those traits foster better health for our patients and for ourselves, renewing our spirit daily. Setting aside our serene setting and outstanding national reputation, at our heart, ours is the spirit of a small town. The residents of Chelsea and surrounding communities look to CCH for education and encouragement to help them live healthier lives. We take that responsibility to heart, sponsoring dozens of programs and partnering with countless area organizations. From our participation in the Healthy Communities Initiative to programs like Move Forward, designed to improve the health of Chelsea's youth, we touch every part of this wonderful community. And this wonderful community touches us in return. Being a vital part of such a vital place, also means that our spirit is fed by the exceptional work of our volunteers. Today, our auxiliary is made up of nearly 200 dedicated volunteers who can be found making a difference in every area of our hospital. Our community also sustains us. The hard work and dedication of our volunteer Board of Trustees has helped us chart a course of success over 4 decades, providing guidance and celebrating every accomplishment with us along the way. The generous, selfless gifts of countless donors over the years kindles in us a spirit of gratitude. However you define it, we know that our spirit is unique, and from the very beginning, it has set us apart. No wonder patients prefer us. No wonder top doctors choose to practice here. No wonder we have such a high rate of staff retention. And no wonder one of the region's top healthcare systems, St. Joseph Mercy Health Systems, has chosen to partner with us to help chart a course to future decades of excellence. For Chelsea Community Hospital, the next chapter is still to be written. Yet somehow, we already know the outcome. More people in more places will live healthier lives because they are touched by the spirit of this place. Along with our partners at St. Joe's, we will be able to reach farther and accomplish even more in the years to come, sharing our unique spirit. Today is a day to celebrate and capture the spirit of Chelsea Community Hospital. We're just getting started.
When I first started working here, I remember how friendly everyone was. When I went around and met everyone, people told me about how committed they were working at the hospital, what a great place it was. And you know, till this day, I continue to hear from people how friendly everyone is at the hospital and how committed the employees are and how much they're able to really make a difference.
Well, I actually am on my 26th year here at Chelsea, and I've been very fortunate to be involved in the future of the hospital. When I first came here, we had approximately 450 employees, and we had a very campus-like setting, which we've still maintained. And the interesting thing for me is being a resident of Chelsea, I looked at the hospital as an opportunity for me to bring something back to the community and stay in the community and allow me to raise my family and be a part of the community. We've done a great job over the years of developing the campus, bringing services to the community that without the hospital we wouldn't have in our town.
I remember going out to different interviews while I was looking for a job, and my wife will tell you when I came home from this interview, I brought home a bottle of sparkling grape juice because I said this feels like the one. Yeah, I interviewed with Kelly Schmidt, still here, and Dan, and I could tell these were guys that really liked where they were and liked this place. They had a lot of great things to say about the people they were working with.